It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is home care. And joining me is Jacqueline Esterline, Director of Marketing for Levin Home Health Care. I'll get that right if I say it right, Jackie. When you start talking about home care, home health care, and homemaker servicing, it's sort of a tongue tire.
It is a tongue tire, and it's confusing for a lot of people as well, because there's so many different things that each of us can do that the other one can't do. But we usually, most generally, we all work together really well trying to make sure that we are a smooth process because we all need each other. The home health care is going to be an arm that usually happens where Medicare is paying for it, your doctor has prescribed it. That's one arm. And again, Medicare is very specific in what they'll pay for. So when you have the home health care arm going in, doing the Medicare services, therapy, speech therapy, whatever it is, it's only going to be for a specific period of time.
Let's set this. First of all, I want to apologize to my panelists because I didn't even say, welcome, Jackie. So I'll say, welcome, Jackie.
Thank you.
You're quite welcome. We get the formality out of the way, but those tongue-tire words. And my first question is, what is the difference between home care, home health care, and homemaker companion services?
Okay.
I think it's, we do a lot of shows on this, and on our website we have a lot of different companies. However, each company has a specific thing they do. A lot of times you can intermingle the services, but it's extremely important for people seeking care, Jackie, to understand what they need.
Right.
So how about you explaining it?
Okay. Well, the home health care, that's your Medicare part that's prescribed by your doctors. The home care portion with what we do at Levin is going to be more the services that are equally as important as what Medicare feels is important, but it's going to be more on a consistent basis, more on a daily basis. It's going to help you with bathing. It's going to help you with dressing. We're hands-on for folks, helping with transfers, getting from your bed to help you get onto your walker, helping you to get to the toilet. If you are in a situation where maybe you're wearing a brief, you're having problems getting back into a regular schedule with your with toileting needs, we can go in and help you with those things because that happens. But again, we're going to be that component that's hands-on. We can touch. That's the important thing to remember that we can do. Companions come into play when maybe you just need a companion. You need somebody that's going to maybe read a book with you or go shopping with you, just keep you company. Maybe they'll cook some meals and things like that, but they're not going to be able to do hands-on care. They're not going to be able to help you in the bathroom when you need it. They're not going to be able to help you getting dressed. They're just not. That's just not what they're licensing.
Okay, but they could get the underwear out of the drawer and hand you the underwear, but they couldn't put it on you.
Correct. Absolutely.
Where your license would enable you to actually take the underwear, put it on the person, slide it onto the person, and pull it up.
Correct.
And get them dressed.
Correct.
I think that I find a lot of people seeking services are very confused about toileting and showering. Companion services could help the person get to the shower.
Well,
stretching it a little bit. Let's go with mine, and then you can correct me. They might steady a person to get to their walker. They can't do that?
No, a companion cannot touch. And if you go on to the Florida Assisted Living website, and you can go in there and look at exactly what the specific definitions are, and under homemaker and companion, it specifically says may not touch. It's in black and white, may not touch. So we can't, I mean, a companion is not allowed to steady a person. They are not allowed to touch that individual in any way, shape, or form. But with home care and a CNA and a home health aide, our license says that we can do that we have folks that are working for us, that we have available to us that can touch the person, that can help them in the shower, can wash their back, can help them maintain their balance if they're a little wobbly and they're getting into the shower, to their shower seat.
It's extremely important to understand that. Because if you hire a service thinking they can do this, what needs to be, because a lot of times we're in Melbourne, Florida, but somebody that hires you might live in New York. And they hire you to perform this service here, thinking that it might get assistance with toileting, wiping, showering, scrubbing, and you can't do that.
And that's important to remember, because here in Florida, we have so many people that come from different states, and their families are trying to help, and they're trying the best that they can. And maybe they've gone to some place similar, talked to folks in a similar business as what we do in their state, but the states are different. Every state is different on what their guidelines are for what a CNA can do, what a home health aide can do. And it's important for families to understand that just because you went in Pennsylvania and talked to a home health care or a companion service doesn't mean that in Florida or any other state they're going to be able to be able to do the same things.
Well, when I do legal shows, when I have elder law attorneys on, we always raise a red flag about making sure that your wills and other legal documents that were written in New Jersey are equally apply in Florida. Many times there are little nuances that generally won't make any difference, but you can run across situations where they make a tremendous difference. And if you, Levin, one of the questions that we wanted to talk about today was about whether or not you required a contract. Does Levin sign a contract? Do you have a contract?
We do not. And let me tell you why we don't. We feel
this is interesting.
We find that it is really important to work with the person's needs and not to go in and tell someone, okay, we're going to sign a contract and you are locked into a month of service for so many hours, and we're not going to really negotiate. You need to do so many hours a day, a week, whatever. We think it's real important for people to understand that we know things change, that you may need us. We may go in and be helping someone consistently for 5 days and 8 hours a day. But we also know that through some of these other things that are going on, whether it's through the Medicare agency or whatever, you're going to get better. And so when you're getting better, you need to be able to back off those services, as well as affordability. I mean, we all know and understand that you're going to be paying for this, for the most part, out of pocket. So it's real important to work with the individuals, what they need at the moment, what they can afford, and make it flexible, because things change. And for me to say, well, you have to sign an agreement, and this person's going to have to be in your home for 3 or 4 hours, and 3 days a week, that just doesn't work. I mean, it's taking advantage of people.
Do you have a minimum amount of time that you have to, if somebody if somebody buys your service?
No, we do not. We'll do an hour up to live-in care. So, and live-in care, just to clarify that real quickly, live-in care depends on the situation. We have caregivers that'll actually, basically, they'll reside in the person's home 24 hours a day, 5 to 7 days a week, because they usually take a break and we have a fill-in, but they have to be allowed to sleep for 8 hours. Everybody needs some sleep.
Oh, yeah.
So, and in that situation, we need to be sure that the person is, safe, they're sleeping for 8 hours, whatever, that it is safe and right for our caregiver to be able to sleep for 8 hours. So that's the one live-in situation. The other live-in situation is we're bringing 2 caregivers in. They're working 12-hour shifts. It's 2 individuals, but they're to be staying awake. They're not going to sleep at any period of time. They're staying awake and keeping an eye on the individual. That comes into play a lot of times with folks that have dementia. Maybe they've just had some kind of procedure done, but it's real important to have eyes on them 24 hours a day. So
Okay. We're getting into areas that sometimes could be difficult to talk about on a TV camera. However, having said that, I think it's fair for our viewers to know that nursing home costs are in the range now of $9,000 to $10,000 a month.
Mm-hmm. Correct.
And if a person has advanced dementia and requires constant supervision, you're looking at $10,000 a month for that person. Mm-hmm. If Levin Home Care came into a home and provided 2 caregivers, mm-hmm. could you give me a ballpark cost on that per month?
You're looking at, and I'm going to guesstimate because I don't have my calculator here.
Okay.
I believe you're looking at $360 a day times however many months or how many days there are in the month. So $360 a day for that split shift kind of thing for the 2 caregivers, 12 hours.
So it is expensive.
It's expensive. It is.
And when you get into that, you're talking about trade-offs. Does the family want to keep the person in the home, mm-hmm. or do they want them to go to a nursing home? Mm-hmm. And most people prefer to stay in their home. Mm-hmm. But what I also sense is that if a family can take part of the care, then you could work a situation out where maybe 11 would come in 16, 17, or 18 days a month, mm-hmm. and then the family could take care of them the other part of the time.
Mm-hmm. And we do that quite a bit. We'll work that out.
What it amounts to is talking to Jackie Esterline, who is the marketing person for Levin Home Care. Mm-hmm. All situations are not the same, Jackie.
They're not.
And that's why I thoroughly enjoy doing shows on home care, because there's so many different elements. And before the show, I talked about what I call elements of care, where we start out with home care and then putting somebody in daycare, and then maybe having home care services come mm-hmm. in, and then going to an assisted living facility, and mm-hmm. then going to a dementia care place. Mm-hmm. So you just don't plug somebody into a hole on this spot without thinking where they really need to be on that level
right.
of care.
And let me just kind of throw in right now, sometimes parents aren't always open with their children about what's going on. And I've been in this business now for 15 years. I've actually worked facilities, home care, and before that taking care of my parents. And the kids don't always know. I've seen more times than not that mom and dad are very cautious about what they want to tell their children about what's going on. And so when a crisis occurs and some quick decisions have to be made, they've not even thought about what's going on with mom and dad as far as the bad side, and things are changing. Maybe they've noticed they've slowed down, but not always are they noticing the changes in their memory or just normal activities of daily living, that they're kind of letting things slip. They just don't think of those things. So when a crisis occurs, they're usually in a hospital situation where things are really bad, and the social workers there are working with that really bad situation. And they may be telling the kids, a skilled facility, a nursing home is the right move. And maybe it is for that moment, but it doesn't mean they have to stay there. They need to look at the whole picture. They need to get as much information that they can and not just settle with this is where they need to be. Because sometimes that's a temporary thing.
Right. But Jackie, been in my line of work that I've been doing with seniors roughly 25 years, I can honestly tell you that I don't find that many people that have the same line of thought that you've just expressed mm-hmm. about getting that person in the right element of care. We need to address the situation that exists at the present time. Mm-hmm. You can either elevate or back off the care. You can do that. And help our viewers understand the whole range of services, the type of thing. We even mentioned insulin shots. Do you do cleaning? What else do you do?
Those things. We'll do, and again, it's the personal care, activities of daily living, the hands-on things. It gets a little, and again, I learned so much coming from Pennsylvania here, because in Pennsylvania, CNAs and home health aides can do one thing, and they can do one thing in facilities and another. So when I came here, I learned, our CNAs here, when they're going into the home, they're going to help with the bathing and the dressing. They're going to remind people to take their medications. But a CNA and a home health aide are not, by Florida law, allowed to dispense medications, I should say. They're not allowed to take things like the insulin and give someone an insulin shot. They're not allowed to do the finger sticks here in Florida. So what you need to do, and again, it's all about us all working together. And when we know we can't do something like that, we can't do the insulin, that's not in our licensing that we can do, that we need to reach out to the organizations, and whether it's through the Medicare and the home health care, or whether it's another avenue, to get those specific things, the injections, the medications, if it's something that needs to be measured out. We can remind, but we can't dispense the medications. Now, we can help with cleaning. Our gals will go in, they'll change the beds, they'll do light housekeeping, and this is kind of something we find every now and then. We get into a situation where our caregiver will go in, and the family thinks that our caregiver, along with taking care of mom, is going to clean the pool, and they are going to, and I wish I were joking, they think that our caregiver will take the toothbrush to the tile. And they'll do light housekeeping. They'll take the Swiffer, they'll wipe down the counters, they'll clean up the bathroom, they'll do those things. But it's not to the extent where they're going to clean your pool or, do that tile grout work.
The reason I'm laughing is I think many years ago, when I was the director of the Alzheimer's program, we had a respite program. We had volunteers would go into homes, and we think we paid into the state of Florida, we paid them $4.40 per hour stipend to do this. Well, these two ladies really wanted to help this one wife, and a guy had been an Air Force retiree. But the ladies made curtains for the ladies' bedroom, and they fixed her bedroom all up, and they really, really, really did. And they come back and tell me what they've done. Mm-hmm. And I knew they did a lot of this out of the goodness of their heart, because it wasn't what they were supposed to do at all. But one day they came in and said, "We've had it, Joe." I said, "What happened?" He said, "The guy wanted us to clean his garage." I said, "You didn't do that, did you?" And she says, "No, we didn't." Mm-hmm. And he also had one of the hairiest dogs that you could imagine, and that dog had left hair everywhere. And so I had to talk to this retired officer about doing something about realizing what the lady's job was, mm-hmm. and that he couldn't presume on them to take care of him and his garage and his dog and everything else. Caregiving is an art and a science. Mm-hmm. And that's why I think it's for people to understand the niches that organizations like Levin can do. But you brought up something very important. In working with different situations where you find it's maybe a Medicare type service is needed, it's important that families understand that many of these cost problems can be worked out if they talk to their primary care doctor, mm-hmm. because that primary care doctor can order the Medicare type services to come in to do the insulin shot, because most of these people we're talking about are 65 or older, mm-hmm. the majority. Mm-hmm. Aren't the majority of the people you care for, they qualify for senior citizens?
Oh, absolutely.
Okay.
Absolutely.
So that's why it's important to have an organization that knows how to make all the pieces fit together, because a lot of the services that can be very costly to the family that don't have the money, mm-hmm. can be paid for through Medicare. But you also brought up a point about a VA program called Aid in Attendance, and I'd like for you to talk to our viewers a little bit about what your experience is with Aid in Attendance and what it is and how to apply for it.
Okay, Aid in Attendance, it's called Aid in Attendance Homebound Benefit. It is basically available to those folks that serve during a time of war.
Serve one day.
One day.
One day.
And I always
is all
say
it
you
takes.
could be, your job was the radio guy sitting on the beach watching a plane, and that was just for that one day during a time of war. And you're eligible. You didn't have to retire. You didn't have to do, frontline duty. It's just you served one day during a time of war. Now, I will say as well, what has happened though, there are a little bit of more specific changes. With the folks that served in Korea and Vietnam, it gets a little more fuzzy because there's something called boots on the ground. I don't understand, but I know with the World War II folks, it's one day during a time of war. They can give the VA a call, and that is going to run at the end of the show, or at some point in time there will be the information of who to call. The VA is a great resource. You'll give them a call and say, this is who I am. I'm getting help in my home. It's costing me a lot of money. And as long as you can prove that you're paying for services, and again, one day during a time of war, you need to have your DD-214 paperwork, your discharge paperwork.
DD-214, if you don't have one, I know where to go to get them.
Yeah, and they'll help you. Like I said, the gentlemen here in Vieira are just absolutely phenomenal. They are great. You can call them. You can go to the office. The downside to going to the office right away is you have to wait. They don't take appointments. Some days you can walk right in, and some days it's pretty busy.
Well, you raise a really good point, because helping seniors is finding a large number of single women that are living on anywhere from $700 to $1,000 a month Social Security, having great difficulty in paying bills, yet their husband may be dead now, but they served in time of war, and it makes them eligible for roughly $1,800 a month of assistance. And it's criminal because these people don't know about these things. And a husband and wife team sometimes qualify for up to $2,500. Sometimes you're living on $1,100 or $1,200 Social Security. The important thing is that too many people talk about government programs being a benefit type program and entitlement. The government has put some really good programs in place to help people over rough spots and to help them at least live a cut above being an animal. We need to make sure people understand what is available.
Absolutely.
And when you and I were talking before we started the show, you explained a lot to me about the VA program, and I think it's important that people need to know about that. What are some of the other nuances, Jackie, that you have discovered in being a marketing person for Levin Home Care about some tips maybe for people to know about in the community?
One of the things that I don't think enough people know about is the diversion program here in Florida. And that, again, if you're a senior and running into some tough times and your income's very low and you don't have a lot of money in that nest egg, maybe you've helped your kids out or whatever, the state of Florida, you can apply for, it's a Medicaid benefit, but it actually will help you, it'll pay for care in the home, it'll pay for, sometimes like getting you to doctor's appointments and things like that if you want to stay in your home.
It'll help pay for transportation.
It'll help with transportation, but it's another one of those kind of best kept secrets that people have, or that people have available to them. And again, it's making a phone call and saying this is what the problem is. This is where I'm having some difficulties. The one thing I want to really hone in on with it though is, and it's even with the VA benefit, they're going to ask you questions, and they're going to ask you questions that make you uncomfortable, because how often do you really want to admit that you're not able to go to the bathroom like you normally had at one point in time, that you have to go and you go? I mean, they're going to ask you, are you having trouble? Can you, are you wearing a brief or a diaper, they call it? I just don't like the diaper term. A brief is better. But they'll ask you these questions, and you have to be honest, and you have to say, I can't, hold my urine. I can't, I need help. I'm not cleaning myself up well enough. They'll ask you about taking your medications. How are you doing? Well, it's not your perspective of how you're doing. How are you really doing? Because some people, it comes down to they can't afford their medications, or they're forgetting their medications. So there's a whole lot of things you need to be, when you're applying and asking for help, that you need to be brutally honest.
Generally speaking, almost every problem that Jackie's talking about, folks, if you get to the right source of information, you can figure out a way to lessen the burden of that problem on yourself. Mm-hmm. And what it amounts to is talking to people like Jackie, like I did a show with a lady that was a director at the Fountains of Melbourne. These people are registered nurses or have great experience in the marketing industry. And you know how to direct people to sources for help. That's one of the things, our information, that's why we started helping seniors, because the information specialist does the case management to get the person connected. You have about 20 seconds. What would be your last comment, Jackie?
Well, my last comment would be just make sure that when you are getting help, that you're making sure that you're getting an organization that has the license, that they're registered with the state. There's many home care organizations here in this area, and I just strongly suggest you make sure that it's a licensed organization, because the state's coming in and they're auditing. We have to have our employees have to be approved by the state. If we're licensed with the state, they're going to be approved.
Thank you, Jackie.